The topic I have chosen to research and learn more about is sleeping disorders associated with sleep. The sleep disorders I have chosen include sleepwalking, insomnia, SIDS, restless leg syndrome, and night terrors. I hope this video gives you an insight on sleeping disorders and teaches you a little bit more than you probably already know. What is sleep? When you find yourself being asleep, your mind, body, and muscles relax. This is a naturally occurring state as it involves the mind moving into an unconscious state. In Stedman's Medical Dictionary, sleep is defined as a natural periodic state of rest for the mind and body, in which the eyes usually close and consciousness is completely or partially lost, so that there is a decrease in bodily movement and responsiveness to external stimuli. If you are experiencing abnormal movements and behavior while sleeping, you may be suffering from another disorder known as parasomnia. It is a category of sleeping disorders that are disruptive and occur in rapid eye movement and non-rapid eye movement. Parasomnias include sleepwalking, night terrors, restless leg syndrome, and sleep talking. Do you ever have trouble falling asleep or remaining asleep? If so, you are suffering from a sleeping disorder which is known as insomnia. Jet lag, stress, and anxiety, hormones, or digestive problems are all causes of insomnia. Insomnia can be troublesome for overall health and other aspects of life, as it can cause depression, weight gain, anxiety, and feeling overtired. Age, the use of drugs, sleeping patterns, and exercise could be reasons for insomnia. Night terrors are a disruption during sleep, which result in a person suddenly waking up and screaming. People suffering from this look to be awake. Night terrors occur during deep sleep after 2 to 3 hours after falling asleep. They occur in children from ages 4 to 12, and some reasons they occur could be because the child is stressed out or sleeping somewhere they may not be used to. Children tend to fall back asleep after the night terrors, and the next day they have no memory of this happening. For treatment, medication is commonly used. If stress or anxiety seem to be reasons for the person experiencing night terrors, visiting a therapist or counselor are helpful. Sleepwalking is when a person appears to be awake and their eyes will be open, but in reality they are actually asleep. Sleepwalking can occur in children, adults, and seniors. In this state, the person is not responsive. People believe it is not safe to wake a person up while they are asleep because it could scare them. Sleepwalking can be dangerous because the sleepwalker could hurt themselves by falling or crashing into things. It is treated with benzodiazepines and antidepressants. Symptoms include little or no memory of the event, screaming, and inappropriate behavior. Some medical conditions related to sleepwalking include nighttime seizures, nighttime asthma, restless leg syndrome, and obstructive sleep apnea. Narcolepsy is a neurological brain disorder that associates with poor control of sleep-wake cycles. These sleep attacks usually last a few seconds to several minutes. People suffering from narcolepsy have an excessive tendency to feel sleepy during daytime. This disorder is associated with the brain, the part that regulates sleep. Most sufferers can fall asleep in inappropriate times while driving, working, and during day-to-day activities. The common symptoms of narcolepsy include loss of muscle control, which is called cataplexy, hallucinations, sleep paralysis, nighttime wakefulness, and microsleep. Lastly, sudden infant death syndrome, also known as SIDS, is an unexplained frightening disorder which occurs in infants from the age of 1 month to 1 year old. During this time, the infant's breathing is paused during sleep, and unfortunately, the infant dies. There are some physical factors that are correlated with sudden infant death syndrome. Brain abnormalities, low birth weight, and respiratory infections can all be reasons that make a child more exposed to SIDS. Restless leg syndrome results when a person experiences cramped and uncomfortable feeling in their legs while they are trying to fall asleep. People with restless leg syndrome often describe these sensations as pins and needles in their legs. Sleep deprivation and alcohol tend to make symptoms worse. It affects both males and females, but is more common in women and can begin at any age, also in young children. Middle-aged or elderly people are affected by restless leg syndrome. Thank you for watching this video, and I hope you learned a lot about the different types of sleeping disorders.